Hi everyone, my name is Alianna Gedlinske, and I'm excited to present my project, Putting Pencil to Paper, Handwriting Intervention in the School Setting. My project was completed in collaboration with The Ohio State University's Division of Occupational Therapy, and my experience was at New Albany Plain Local School District in the primary school, which consists of students in 1st through 3rd grade. In examining the literature, I completed a scoping review following PRISMA guidelines, which examined the PCC question for elementary school students, which handwriting programs or program parameters are considered best practice. This topic holds great importance, particularly in the school setting, since students' main occupations build on written and fine motor skills. Deficits in handwriting skills are very common and occur in 5 to 35% of primary students, making it one of the most common referrals for occupational therapy services. Occupational therapists have the unique ability to see students as holistic beings and can analyze deficits in postural, motor, sensory integrative, sensory motor, perceptual, or behavioral elements that could contribute to a student's handwriting abilities. Selected studies included school-based handwriting programs in kindergarten through 5th grade. Handwriting interventions varied in number and age of participants, length, provider, and session structure. Participants in studies may or may not have been receiving occupational therapy services during the time of intervention, and programs were provided by a school staff member, which may have been a teacher, occupational therapist, occupational therapy assistant, or other supporting staff member. Overall, my review found 10 articles that fit my inclusion criteria. I found that there was low quality evidence supporting the examined handwriting programs and program parameters in the school setting. This was largely due to the heterogeneity of selected articles, though I was able to identify 3 key ingredients which were associated with successful handwriting programs. The first of which was repetition. Successful programs were generally around 3 to 5 days per week, 30 to 45 minutes per session for 15 total sessions. The second key ingredient was individual assessment, with the most common handwriting assessment being the Minnesota Handwriting Assessment. Lastly, integration of the program into the classroom environment was also linked to program success. The goal of my project at New Albany was to implement an evidence-based handwriting program with a classroom of primary students and assess the effectiveness reflecting the key ingredients found in the literature. This project was not implementable at my site without significant revisions. A significant gap exists in the knowledge of handwriting programs in the school setting. Therefore, I completed an implementation analysis. In this analysis, I examined acceptability, appropriateness, and feasibility of the intervention at New Albany's primary school in order to better understand the existing barriers and facilitators. Some barriers included teacher and staff buy-in to evidence-based tiered handwriting programming. Differing opinions on structure and progression, resources, and staff or student availability were also contributing factors. After completing the analysis, I recommended strategies to support future implementation. In a broad sense, I recommended that New Albany evaluates the school's current handwriting programming and seek to promote a mutual understanding of the importance of handwriting instruction. The hope is that in increasing awareness, teacher buy-in will also increase. There should be emphasis placed on early, consistent, and repetitive handwriting instruction in order to promote student success. It is also recommended that teachers use similar lessons and verbiage across grade levels to promote generalization of skills and can feel competent in providing this instruction to their students. There's also a need to ensure integration of evidence into both the handwriting program and the assessments used to measure student progress. I created an algorithm to support the use of a tiered handwriting model in the school setting. Included in this algorithm is identification of the need for intervention to improve school-wide handwriting outcomes. I include the eligibility, which ensures participants are in kindergarten through 5th grade. Students should also be participating in the general education classroom. If they are not, practitioners should move towards a Tier 3 intensive approach. If students are participating in the general education classroom, we then move towards the initial assessment and collaborate with teachers to determine appropriate intervention times. Once the intervention is completed, progress toward the final assessment to measure student progress. Throughout my capstone experience, I also completed additional learning opportunities. Through these, I acquired knowledge, skills, and clinical experience in the school setting. I had the opportunity to complete multiple online trainings to further my knowledge in regards to writing readiness and successful teacher collaboration. I also had the chance to shadow at 4 different schools in the Columbus City School District. During my time at New Albany, I was able to collaborate with my mentors and teachers to provide handwriting lessons to students within their classroom environments. 10 teachers within the school identified areas of need for continued instruction based off of how their students performed during scheduled handwriting instruction. There were multiple areas of need, including letter formation, pencil grip, letter sizing, letter reversals, spacing, etc. Once needs were identified, I would come into the classroom and provide a 20 to 30-minute lesson to address the areas of concern. This is an example of one of the worksheets I used for letter formation. Multiple teachers identified that their students would struggle with top-down formation of letters, which made their work illegible. Students would complete upper and lowercase letters using this worksheet, making sure to start at the starting point you see. I would then facilitate a class discussion to have students identify which letters were the easiest and most challenging to write. We would also complete tracing of letters on a larger scale to promote gross motor movements. Lastly, during my capstone experience, New Albany Plain Local School District was piloting a Tier 2 handwriting intervention created by my OT mentors. This intervention was created for students with an identified handwriting need. Students were recommended for the club based off of handwriting screeners graded on legibility. Handwriting club sessions took place once per week during the student's school day and were about 30 minutes in length for 5 weeks. They incorporated a gross motor warm-up, contralateral movements, fine motor warm-up, and handwriting practice focused on manuscript letter formation. Students were assessed before and after completion of the handwriting club with a modified version of the evaluation tool of children's handwriting, otherwise known as the Etch. Here's an example of one of the worksheets I created for use during the handwriting practice component of the intervention. We also examined the assessments of all 58 students in 1st through 3rd grade who participated in handwriting club. Overall, there was a 12.75% improvement in lowercase letter formation and an 8.82% improvement in uppercase letter formation over the span of just 5 weeks. I also included example assessments from one of our 1st grade students. The writing outlined in blue shows this student's initial lowercase letter assessment. As you can see, this student demonstrated multiple capital letters and overall poor legibility. The writing outlined in orange shows this student's final lowercase letter assessment. Although there's still room for growth, this student showed great improvements with letter formation, adherence to baseline, alphabet order, and overall legibility. These Tier 2 handwriting club assessment results are very promising and hint towards the potential of expanding intervention to more of a Tier 1 model. Here are my key references, and thank you for listening.